Just a year ago, I was struggling daily with debilitating symptoms of my schizoaffective disorder. In fact, one of our most popular videos was me sharing my experience of being hospitalized for a psychotic episode just a year and a half ago. As you probably already know, over the last year, I've embarked on sharing my experience of using ketogenic therapy and metabolic therapies to treat and manage my schizoaffective disorder. And I feel and have communicated that it has been an incredibly healing experience. But I know that there has been some contention around my use of viewing it as a healing experience. And so that's kind of what I want to get into and break down a little bit in this video. So maybe when we start off this kind of breakdown of this as a healing experience, it might be worth clarifying the language a little bit. There have been some people who I think have internalized that I am communicating that metabolic therapies are a cure for schizophrenia or for mental illness. And I just want to clarify that I have never used the word cure or cured. What I am suggesting really is that metabolic therapies have contributed to my own healing of my schizoaffective disorder and of my experience of my mental illness. But even that, I know that some people are having a little bit of difficulty around in terms of me using the word healing even. And I get why that might be a really big, kind of scary thing to wrap your head around when, we have kind of come to a place as a collective mental health community of, kind of accepting that you need to learn how to live with these illnesses and true healing isn't necessarily possible. And maybe even if you go through the same experience or a similar experience to what I've gone through over the last year, you maybe still wouldn't choose to use the word healing. But maybe it would be helpful to take a look at what the definition of healing is. So according to the Oxford Dictionary, the definition of healing is a noun, the process of making or becoming sound or healthy again. And an adjective, tending to heal, therapeutic. And this, I feel, both really resonate with my experience over the last year. I really understand that the language that we choose to use to communicate about our experiences really matters. But I think it's also really important to try to understand how this language can serve to limit or to liberate. I shared in one of our recent videos that the goal of these things is not perfection, but rather possibility. And opening yourself up to that, or opening up your capacity to step into that possibility. And so I'm choosing to view healing as kind of this transformative process. I am continuing to manage my mental illness in a different way using metabolic therapies, but that doesn't change how transformative this experience has been. I've said so many times throughout the last year that I just feel this tremendous increase in capacity. I'm no longer experiencing debilitating symptoms, and I'm just kind of able to step into my life in ways that I had thought were never going to be possible for me. And this really feels to me like a tremendously healing experience. And so maybe just as a quick overview or recap of what I've been doing to manage my illness in a different way, I've primarily been using ketogenic therapy, which is essentially following a very, very low carb diet, under 20 grams of net carbs per day, really high fat and moderate protein. And this is essentially to get my body into a state of ketosis where my brain and body can run off of ketones instead of glucose. The idea is that this is helping to heal my metabolism as well. And then I've also been implementing other therapies to improve my metabolism, such as regular exercise, improving sleep hygiene and circadian rhythms, cutting out drugs and alcohol, stress management, social engagement, purpose in life, and all of these kind of different things that are contributing to improving my metabolic functioning. And all of these different metabolic interventions have served to vastly improve my experience of my mental illness to the point where I don't really experience symptoms of it on a daily basis anymore. And it has improved my overall mental health and ability to show up in my life, which again has felt tremendously healing. Another component of what I've gone through in terms of trying to manage my mental illness over the last 10, 15 years has been how using psychiatric medication has also kind of impacted my ability to function or my quality of life. Being able to reduce my medications over the last year has really kind of opened my eyes to how they were affecting me in difficult ways and how it has felt really good and healing to be able to transition off of them. And now I know that some people have said that that is my definition of healing, but that really is not it. That has been kind of an additional side effect benefit of this all, is being able to reduce my medication and ultimately improve my quality of life in that regard too. I have been completely off of all of my psychiatric medications for almost 4 months now, and I am feeling really the best I ever have. And now that is not to say that I am against medication or even that I am against going on it again personally in the future. But where I'm at right now, I know that it's not something I necessarily need. However, again, open to revisiting that or incorporating it as needed in the future. Of course, working closely with my care team on that too. And so now a big kind of common criticism or response to all of this in terms of me using metabolic therapies to manage my mental illness and feeling and communicating that that has been a healing experience. There's been a lot of people saying, well, you can't say you're cured or it's not healed unless you're able to go back to the way you were eating before or what you were doing before without implementing these metabolic therapies. If you can go back to that and if you can stop using metabolic therapies and still be symptom-free, then you can say you're healed. And basically people just saying that if I can't go back to eating lots of carbs and sugar without symptoms, then I can't say that I'm healed. And I think that this is interesting because I don't think that this is the way we would look at really any other disease or illness. It might be worth thinking about this with a different illness. Let's say, for example, someone has lung cancer. They've smoked their whole life and it has resulted in them developing lung cancer, but they've gone through treatment and they are now cancer-free. I don't think that anyone would say to that person, well, you're not healed or you're not cancer-free unless you can go back to smoking multiple packs of cigarettes a day and stay cancer-free. That is ludicrous. I'm really not trying to hide anything or trick people, in terms of using this intervention that is managing my illness and saying that I'm completely healed. That's not what it's about. I think I've been very transparent about really focusing on lifestyle changes that I've made in line with metabolic therapies. And the fact that I am using these to manage and heal my illness does not at all negate the deeply transformative healing process that I've experienced through it. And there are a ton of different health conditions that do require ongoing management. Stuff like diabetes, high blood pressure, all these sorts of things that require lifestyle interventions to maintain wellness and healing of these conditions. And again, I just don't think that that takes away at all from the healing aspect of what people experience using these. And now I think that I use the word healing really beyond just the healing experience of reduction of symptoms of my mental illness. This last year, and really diving deep into what it means to take ownership over my health and well-being and to, be able to step into this new experience of my life has been profoundly healing on its own as well. My entire outlook of life has changed over the last year. I've always kind of fallen down holes of existentialist thinking, and for the longest time, that was like a core element of why I struggled with, depression and just having a really difficult time of understanding my place in the world, especially navigating difficulties that pertain to my mental illness. But I don't know, something has shifted over the last year where I still have similar thought patterns and whatnot, but my perspective on it has shifted to be one more of, what I talked about in a recent video of trying to be open to possibility, looking at the world and my experience of it with awe and gratitude. And I can't understate enough how much that is a portion of my healing experience over the last year as well. And I really think that a lot of this does have to do with, again, taking more ownership over my life and my well-being, but also just this increased capacity that I have been able to feel as a result of ketogenic therapy and these metabolic interventions, where I am feeling like I'm able to give so much more of myself to my own self-development, to my relationships in life, to how I show up in work, and yeah, just overall how I'm able to show up in and experience my life. I feel a way greater ability to just be present in my life. And that was something that I really struggled with for a long time, largely as a result of struggling with my mental illness and debilitating symptoms. But again, it goes so much beyond just eliminating symptoms of my mental illness and what I understand as a really healing and transformative experience. There has been tremendous healing over the last year in terms of how these metabolic interventions have reduced and eliminated symptoms of my mental illness. But it goes beyond that too, even. And it's a little bit hard to communicate this because, I lived with this for my whole life, this sense of not really being able to fully step into experiencing my life, but having more space in my head and my experience of life as a result of eliminating the symptoms and the difficulties that came with my mental illness has really allowed me to step into a life with more possibility and to engage in my life in a way that I had never thought was going to be possible. And that has been a tremendous element of this healing experience as well. And now I'm going to get into why it may be problematic to get too far into policing vernacular that we're using to communicate about healing experiences and whatnot. But before I do that, I do kind of want to maybe validate where some of these difficult feelings about how I'm communicating this may be coming from. And I wonder if maybe I have been kind of communicating this idea that my life is completely changed. I'm a different person with no relics of mental illness anymore, because that is not the case. And I'm actually planning to do a full video on this, talking about how I still feel like my brain works a little bit differently. There is some element of whatever you want to call it, neurodiversity, mental illness still at play in the way I experience life, because it's been a huge part of the way my brain and I have developed throughout my life. And so to clarify that, when I say healing, I'm not meaning that every last piece of mental illness or that experience for me is gone and my life is completely different. Not at all. What I mean by healing is more things like I don't experience debilitating symptoms anymore. I don't experience side effects from medications anymore because I was able to get off them. And maybe more importantly, my perspective and way I'm able to experience my life has shifted and changed and evolved. And again, that has felt really, really healing. So I have used words like healed or in remission or in recovery. And I think that unfortunately there is a lot of debate happening about which word is accurate or right or what I should be using, going farther to other words that maybe people have inferred from what I've communicated, cured, whatever it may be. But I think that getting too hung up on that specific vernacular and language is kind of missing the point. And I think that it would do us a lot better to focus on understanding the experience and the possibility enmeshed in that. I have experienced profound change and relief in the experience of my illness. And I think that it's way more worthwhile to focus on that and to talk about that and explore that and focusing on the tangible life improvements rather than on policing terminology to communicate about that experience. I think that over-fixating on whether a term like healing or curing is possible ultimately becomes a pretty self-limiting belief. And fully acknowledging that this largely stems from societal narratives that we've all come to internalize about what it means to live with a chronic mental illness. We've kind of been put into this box where we've been told, you will never recover, there is no cure, you will never go into remission even oftentimes. And that can be really, really limiting. And I think that we need to be really careful as a community of people experiencing mental illness to not over internalize this and incorporate this limitation as a part of our identity. Why can't we be way more open to what could be possible, especially when our understanding of medical and lifestyle interventions are continuously evolving? And so to kind of wrap this all up, I think that I have always looked at the concept of healing as a very subjective experience. And what this means to each individual is probably going to look a lot different. And yeah, this past year for me has been one that to me personally has felt incredibly healing. And that maybe, again, there is some sort of breakdown in communication happening here where maybe people are internalizing me communicating that I've gone through a healing experience as meaning that I have reached this conclusive endpoint where I am healed, I am rid of mental illness, and I am a different person. And that's really not what I mean at all. I've said this a lot on our channel over the last 6 years, that recovery is never going to be an endpoint. It is kind of an ongoing journey that you are going to be going on for the rest of your life. Likewise, I feel that this healing journey will continue to evolve probably for the rest of my life as well. I know that these various interventions that I'm using, metabolic therapies, are going to require continual effort, but continuing to prioritize what my brain and my body need to thrive and to go through this healing experience does not at all underscore the profound healing and progress that I've made. The fact that I need to continue to use these metabolic therapies to allow my brain and my body to thrive does not at all diminish the healing and profound progress that I've made. And like I said earlier in the video, I am totally open to revisiting what kind of interventions I need to use for my brain and my body at various points. Maybe that will mean needing to use medication down the line. I don't know. Again, progress and healing is never really a linear thing, and we can never really know what's next. But I think that there is, again, tremendous value in taking stock of what we've done to help ourselves and how that can be a really transformative and healing process. So I really want to take this opportunity to encourage you all to remain open and curious to emerging therapies or different ways that you can ultimately improve your quality of life. And again, another really important reminder that I have implemented all of these metabolic therapies and worked on treating my mental illness in these alternative ways in conjunction with my care team. And that has always been a priority to make sure that I was doing these in the safest and most responsible way possible. So I would love to hear from any of you about your own experiences or journeys of healing, or any questions you may have about this as a concept in the comments below. Make sure to subscribe to our channel if you want to learn more about mental health and specifically using ketogenic therapy and metabolic therapies as an intervention. And about what could be possible in terms of healing. Everyone's path of navigating their mental illness or of really any challenges in life is going to be unique and look different. And I am sharing my experiences with the intention of being a message of hope, not necessarily as a prescriptive thing for others to follow as well, but more trying to challenge what we think is possible and to ultimately rewrite the narrative that we've been fed about what it means to live with a chronic mental illness, and really trying to introduce this idea that healing is possible. Thank you so much for watching this video, and as always, wishing you and your loved ones good health. We'll see you in the next one. Bye.